Hey everybody, thank you for joining me. It's Abigail with Medicare with Jake. And today we are going to answer probably one of the most common questions we get. What option should I choose when it comes to my Medicare coverage? I get asked in nearly every appointment, okay, what should I do? If I'm your mom, if I'm your grandma, if I'm your grandpa, what would you do? What would you tell me? And what I will tell you is this is a very personal decision, right? This isn't about me as the agent. I'm here to educate. I'm here to help you understand your options. But this is not my healthcare and it's not my finances. This is about you and really helping to make sure that you have the information to make the best decision. But we can very clearly outline what your options are. So in theory, you have three options when it comes to Medicare. Okay, you have three different directions that you can go. The first one is to just have Medicare. You've got your red, white, and blue card, your Medicare Parts A and B covered, hospital, doctor, medical coverage, and add that prescription drug plan to it. No penalties, we're getting our prescription coverage, all that good stuff. So that's option one. Now, while that's an option, it's not a great one. And the biggest reason for that is your financial exposure. A lot of people don't realize that Medicare only, so just the red, white, and blue card, the original Medicare program, has no max out-of-pocket limit to you, the member. Meaning there's never a point where you've spent all the money that you have to spend and Medicare is going to pick up the rest. I personally have 3 clients that prior to meeting with me just didn't know what they didn't know, went this route, got Medicare only, avoided the penalty, so they got a drug plan, but they didn't have anything to cover those different costs related to Medicare by itself. One of them left with a $10,000 bill, one is left with a $38,000 bill, and the worst is an $86,000 bill after Medicare paid. This is what they owe. So it's not that you don't have coverage or don't have access to care, certainly. Today, about 92–93% of providers nationwide take Medicare, so it's certainly not because you don't have providers available to you. It's a financial risk. It's one you just don't need to take. There's no protection to you, and we don't want to take that risk any time in our life, but certainly not now. Certainly not when we're on more of a fixed income and we're reaching those years where we want to enjoy our money and not have to spend it on healthcare. So we take that option off the table. Anytime I'm sitting with a client, we make a grid of 3 options, but I make a big X through that option. It's just not a good option. So that leaves us with 2 really good, solid options. Both of them are going to protect you from Medicare only. They're both going to make sure that you don't have that unlimited cost potential, but they're going to do it very differently. So the first good option, or option 2, if you will, is your Medicare Part C. So from previous information, videos, and our website, Medicare has 4 parts. If you remember, original Medicare is A, B. So hospital is your Part A, B is your doctor medical. Medicare Part C and D came out around the same time, roughly 17 years ago. D for drugs, so just a reminder, that's your prescription coverage. And then Medicare Part C. These are your all-in-one Medicare Advantage plans. These are the plans definitely advertised quite a bit. We've heard them, we've seen the TV commercials, all that good stuff. These are the plans that take and wrap up your Medicare benefits into one plan. So I like to think of it almost like a little math problem. It's a math equation. We've got our Medicare Part A hospital coverage plus Part B doctor or medical coverage plus Part D prescription coverage, and that equals Part C. So A plus B plus D equals C in the Medicare space. So these plans are an all-in-one plan, and they are offered by private insurance companies. They are going to include benefits not only related to your Medicare, your A and B and D, but also other benefits such as dental, vision, hearing, gym memberships, over-the-counter items. Some have flex cards or personal emergency response systems. You can get Fitbits. I mean, there's all kinds of things, right? So these plans can come with a lot of benefits on top of Medicare by itself. Now, these are going to look really similar to your employer coverage that you had. They're, again, administered by private insurance companies, and most of them are zero or very low premium. Now, as kind of a refresher, how can they do that? Because our first thought is timeout. How is that possible? How could we possibly get a plan to help me with my Medicare, but I don't pay anything for that? That doesn't make any sense. So first things first, you're still paying for Medicare, right? We have a premium on our Medicare Part B, so we're not getting out of that. We've got to pay Medicare, but the plan itself is zero premium, and the reason for that is they are funded by Medicare. Medicare is providing the funding on an annual basis to these private companies to create plans that cover you, and they have to take 85% of the money that they receive from Medicare and put it into benefits in the plan. So that's why you're going to see things covered that aren't covered by Medicare, like of course dental, vision, and hearing, but also things like gym membership, maybe even transportation rides, things like that. Those are definitely not covered under the original Medicare program, but why they can cover them on these plans. They're taking that money and funding from Medicare and building out a plan for you. Now, how these are similar and different to employer plans: one, they're network-based. So again, we're used to that. We have PPOs, we have HMOs. I won't dive too deep into that. But basically, these look really, really similar in having a network of providers that we want to stick with. That network is going to allow us to get the most cost-effective coverage. Some plans allow us to go out of network, some don't. Some require referrals, some don't. So this is where we get real specific and real personal in that conversation. What they do all protect you from is that Medicare unlimited out-of-pocket cost. Okay, so they all have a maximum out-of-pocket limit. And ironically, Medicare sets what that limit has to be every year. So even though they don't have a max limit on themselves, they make these plans have a limit and tell them what it has to be. Some are very low. I mean, we've seen some in the low thousands annually, and some will go up to the max, a little over 7,000. So it really kind of depends on your area and the plans available and the carriers, the companies themselves. So you do have the protection of unlimited out-of-pocket costs. That's not going to happen. You do have a network. So the first thing we're going to do is make sure that your doctors and providers are covered, and then your medications. Of course, it covers your prescriptions. We've got to make sure we're picking the plan that works best for you. So the other differences yet similarities, so no premium, which is different than when you were working. There's also no deductible on these plans. Very few plans have an actual medical or even prescription drug deductible. So that's something else that really sets it apart from compared to when we were working. But how we pay for these plans, nothing's free, right? We understand that. Our healthcare is certainly not one of those things that's free. So we know we're going to pay something. This is just as a pay-as-you-go sort of model. We're going to pay for services when we need them, as we need them. So if you have a primary doctor visit, you're going to pay $0 to maybe $10, depending on the plans in your area and those costs. If you have a specialist, you might pay $25, $40, $50 for that specialist visit. A day in the hospital is going to have a copay associated. If you need an MRI, you're going to pay a copay for that. Lab work and some other services traditionally with most plans are $0, but a lot of what you're going to have done, an outpatient surgery, an ambulance ride, any of that stuff is going to have a copay attached to that. So almost every service with our plans, these Medicare Advantage plans, do have a copay tied to it. Some, it's a co-insurance, meaning you're paying a percentage of the cost. So maybe the plan covers 80% of the cost of durable medical equipment, for example, things like a nebulizer machine or CPAP machine, and you pay 20% of that cost. So, but for the most part, that is how you are going to pay. Any of the services that you pay for, any copay, any co-insurance, is going to go towards that maximum out-of-pocket limit on your plan. And if you hit that number, you're done paying. The plan picks up the rest for the rest of the year. So that's that protection piece that's missing from Medicare only. Now, prescription drug copays do not go towards that max out-of-pocket. It works like its own little prescription drug plan within the plan. But in terms of any medical costs that are related to your A and B benefits, your hospital and doctor medical coverage, any of those costs that you pay for are going to go towards that max out of pocket. So that's how your Medicare Part C plans work. Again, it's sort of defined as an all-in-one. You're getting all of your Medicare benefits in one, plus a few extra things depending on the plans in your area, and you're paying as you go. So instead of a monthly automatic premium or a high premium, you pay little to no premium and pay co-pays and co-insurance for services as you need them. That's really the nuts and bolts of how a Medicare Part C plan works. So it may or may not be the right fit for you, but that just at the end of the day, it's important to understand how they work, how they're funded, how they can be zero premium or low premium. It's not a scam, that is legitimate. They're just being paid from Medicare, and that's how they're able to offer those benefits to you at a low to no premium cost. So then we've got a third option, or again, really a second good option. Now this is probably one of the most familiar options when it comes to Medicare. These have been around just as long, or just about as long, I should say, as Medicare itself. And these are your Medicare supplement plans, or you'll also hear them called Medigap plans. Their job is to fill in the gaps, or to supplement, hence their name, the things that Medicare A and B, your hospital and doctor or medical coverage, approve but don't pay for. Okay, so you've learned through our videos and through information and through our website, Medicare has deductibles, there's 20% co-insurance, there's co-pays for hospital stays, things like that. There are things that Medicare approves but does not actually pay for themselves. That's your responsibility. So that's what you're doing with a supplement plan. You are hiring a company, it's still an insurance company, and you are saying, I'm going to pay you every month to pick up my tab. I'm going to go to the doctor, I'm going to go to have a surgery done, I'm going to be in the hospital, and I'm going to sign my name and walk away. I'm not going to have a copay, I'm not going to have a co-insurance, certainly not with most plans, let me say that. There are actually 10 supplement plans on the market, 8 of which that are available to anyone. 2 of them were pulled off of the market in January of 2020 and are only available to those who were 65 before January of 2020. So there are a couple of plans that are limited availability, but the other 8 plans are available to anyone in the Medicare market. And they all cover different, and they're all by plan letters. So it gets a little confusing when we talk about supplement plan B, for example, is not the same as Medicare Part B. So this is, again, where we're going to come in and explain the differences, go through those different supplement options, what they cover, how they cover, and make sure to distinguish the supplement plan from your actual Medicare benefits. But you're going to pay a monthly premium to that company depending on the plan, and depending on where you live, those premiums are going to vary greatly. Not to mention if you're male or female, tobacco use can come into play as well. But you are in essence saying, I'm going to pay you to take care of everything. I don't want to take a copay or a co-insurance to the doctor. I don't want to get a bill after the fact. I want to sign my name and walk away. Now, a lot of people like this option because it's a fixed cost. Right? That's easy to budget and manage. You know exactly what you're going to spend, you pay your premium, you sign your name, you walk away with very little to no additional out-of-pocket cost. So on the one hand, there's a lot of convenience to that. On the flip side of that, people look at that and say, well, man, I'm paying that same premium even if I don't use the plan, which is true. You're paying that premium whether you go to the doctor 1 time or 100 times. You're paying that same premium. And that can start to feel, maybe people want to more do the pay-as-you-go option because they just want to pay for things when they actually need them. One thing that is very nice with the Medicare supplement plans is there is no network. So while the Medicare Part C plans keep their costs lower by using a network of providers, Medicare supplement plans have no network. Your network is Medicare. If they take Medicare, they take your plan, period. Doesn't matter where you live, doesn't matter where you bought it, doesn't matter where you're traveling to. If they take Medicare, they take your plan. Now there are some plans, some supplement plans called select plans where they're a little bit lower in price and do have some limitations, more of a network to them, but that's again kind of one of those one-off situations. In general terms, Medicare supplements your network as if they take Medicare, yes or no. Then you can go to that provider. So super convenient, very flexible, nationally available and accessible to you no matter where you live, no matter where you bought it, no matter where you travel. So part of what you're paying for is easy. You're paying for convenience. You're paying for freedom and flexibility, right? These aren't medical costs, but you're saying it's worth it to me to just be able to set it and forget it and not have to pay for it and not have to pay as I go, but to just pay for it and be done with it. Now, a downside to this, we said that the Medicare Part C option is an all-in-one option. It comes with all those parts of Medicare in one. Well, if that's true of Medicare Part C, or our first option, that's a good option, we're looking at an a la carte way of doing our Medicare with our Medicare supplement, our option 2, meaning you've got to buy a supplement plan to fill in those gaps with your A and B benefits, but that doesn't cover prescriptions. And we already know we've got to have prescription drug coverage. We don't want to be penalized for not having it. We don't want to be stuck or lost without prescription coverage when we need it. So that's an essential minimum second policy you have to add to this option. It does not come included with your supplement. So we are going to add a Medicare Part D prescription drug plan, and we're going to pay a separate premium for that plan. So this is the more a la carte option. We're buying our supplement or our Medigap plan to fill in those A and B gaps. Then we're buying a prescription plan to fill in those needs that we have on Medicare prescription drugs. And then if we want it, we can certainly have a similar package, but we're adding and paying for them each individually. If you want dental, we can add a dental plan. We can add vision. We can add hearing. Certainly you can join a gym and you can pay for a gym membership, but that is not going to be included, or very unlikely to be included in your supplement plan. So with that option, we're going to have at least 2 premiums we're paying per month on top of Medicare. Again, we're paying Medicare no matter what. We've got to pay our Medicare Part B premiums just to be eligible for these plans. But we're paying now a supplement premium and a prescription drug premium and dental and vision and so on and so on. So again, some people like this because of that freedom and flexibility and that fixed cost nature. There's no surprises if any health thing comes up that just really rocks their world. You know exactly what you're going to spend, and there's not as much of a surprise in your out-of-pocket cost. And at the same point, some people like the pay-as-you-go option, saying, I just want to pay for services when I need them. I could pay more in co-pays than premiums. I could also pay more in premiums than co-pays, right? Until someone can tell me exactly what next year holds for them, there's no way to know for sure. At the end of the day, that's why I started this by saying this is not about me, it's not about my health care, and it's not about my finances. Our goal and our job is to really just provide you the education and information needed to understand what these options are, how they're similar, how they're different, and how they will impact you long term. You do have options to potentially switch from plans to plans. If you change your mind, you start one way, decide to go another way, that's a whole nother conversation. You're not necessarily locked in or stuck with one option or another. But that's when it gets really personal. Some require health qualifications and some don't. So that's where we've really got to make sure that we're just discussing all of your needs on the front end, and then yearly continuing that conversation to make sure you're always in the place that's right for you based on your needs, your health, your finances, your travel wishes. I mean, all the things that you want to make sure are taken care of. That all comes into play in these conversations. So like we said, we get asked all the time, which is the right option for me? And as I said before, this isn't about me or my health care. This is about you. This is about your needs, what's specific to you, and really understanding your options, which is the right fit for you. And no one else can decide that. We even have spouses, husbands and wives, couples that are together that say, one has one option, one has another option. Your health needs are different. Financially, things can be different. What your neighbor has, what your friend has, what your doctor suggests, all of that. We don't say don't talk to anybody about it, but at the end of the day, you need to make the right decision for you. And that decision needs to be based on information on how these plans actually work, how they differ. Again, there are pros and cons, what's good, what's bad. Neither's perfect. You're going to have things you wish your plan did that it doesn't, and vice versa. And at the same time, they're protecting you, both of them are protecting you from that Medicare only option that is the riskiest option. So at the end of the day, you've got two really good options, and we want to make sure that you get the right fit for you and are annually on a regular basis reviewing that to make sure it's still the right fit. If you have any questions, would like to dive deep into your personal situation, your needs, your questions, which is the right fit for you, we'd love to help you with that. Reach out to us at 833-NOW-JAKE. I hope you guys have a great day.